Okay, so we talked about the symptoms of the different cerebral arteries, the stroke symptoms that you'll see, the most common being the middle cerebral artery. Arteriovenous malformations, when they rupture, they often cause hemorrhagic strokes. And a lot of times the result of a hemorrhagic stroke is death. It can be, you can, sometimes if you get in soon enough you can recover from it, but sometimes you can't. Aneurysms are another disorder of vascular formation, and an aneurysm is a dilation in the wall of an artery or vein. The swelling has thin walls that are more prone to rupture than the regular walls. So saccular aneurysms are the most common. They only affect one side of the vessel wall, so the vessel wall sort of bulges out a little bit. A berry aneurysm, which is in this picture, is a small sac that protrudes from a cerebral artery and has a thin connection with the artery. So that thin connection, when it's under pressure, is more prone to rupture, resulting in a hemorrhagic stroke. So the blood-brain barrier is a specialized permeability barrier between the capillary endothelium and the central nervous system in the extracellular space. So the blood-brain barrier is formed by tight junctions between the capillary endothelial cells that exclude large molecules. So the exclusion is useful for preventing pathogens from entering the central nervous system, and it also prevents certain drugs and protein antibodies from accessing the brain. So there's certain drugs, a really good example of this is the drug that is used to treat Parkinson's, carbidopa-levodopa. The trade name of it is Sinemet. It is a form of L-dopamine. And L-dopamine actually can't cross the blood-brain barrier. So people are missing dopamine in Parkinson's. You can't just give them dopamine because it can't get into the brain. So they give them a form of it that can get into the brain and then get transformed into dopamine to be used like dopamine in the brain. So that blood-brain barrier keeps out things that it doesn't want in the central nervous system. And so it's our cells working for us to protect us. The blood-brain barrier is absent in areas of the brain that directly sample the contents of blood or secrete into the bloodstream. So this includes parts of the hypothalamus and other specialized areas around the third and fourth ventricles, and that's right in the center of the brain. So there are specialized cells that are called tanocytes that separate the leaky regions in the hypothalamus, in that area, from the rest of the brain. And these cells prevent proteins and viruses and some drugs from entering the brain via the leaky regions. So it's a pretty good system for preventing pathogens to get into our brain. So the oxygen consumption increases from the brainstem to the cerebral cortex. So the cerebral cortex is more vulnerable to hypoxia than the vital centers in the lower brainstem. And that sort of makes sense from a survival point of view. When I think about whether things make sense or not, I think about, is this important for survival? If you have a small amount of hypoxia, like say you go to South America and climb up in the Andes, a lot of times you can recover from hypoxia by just going down lower because the vital centers in your lower brainstem are still working. But the cerebral arteries actually auto-regulate the local blood flow depending on blood pressure and the metabolites that are in the system. So the auto-regulation is really important to ensure adequate blood flow and prevent brain edema. So when you look at the layout of the arteries in the circle of Willis, it's sort of like there's more than one route to take. So you're driving down to Seattle, and if I-5 is blocked up, you can go over to the 405. If they're both blocked up, that you might have a problem. But it's sort of the same thing with the cerebral arteries. There are some collaterals that are connecting together that are like the 520 bridge that can get you over to the other to the other side. So those cerebral arteries do a lot of work auto-regulating that blood flow, making sure that the cerebral cortex has all the oxygen that it needs, and preventing cerebral edema. So cerebral edema is the accumulation of excess tissue fluid in the brain. So it can be caused by concussion because you get damaged capillaries from the force of the concussion, allowing fluid to leak from the damaged capillaries. It can be caused by cardiac arrest because it affects blood flow. It can be caused by going to high altitude. The fluid pressure from going to high altitude results in ischemia and causes arterioles to dilate, increasing the capillary pressure and producing more edema. So edema can be alleviated by shunts, like we talked about with hydrocephalus, or sometimes medications, or if you're in the Andes, you can go to a lower altitude to relieve the cerebral edema, because it can be a serious, life-threatening thing. Cerebral edema, hydrocephalus, tumors, or other lesions can cause an increase in intracranial pressure. Symptoms of increased intracranial pressure can include vomiting, nausea, headache, drowsiness, frontal lobe gait ataxia, so it affects the motor planning areas, and visual and eye movement problems. So lesions can produce a herniation in part of the brain. So a herniation is where part of the brain bulges out when you have a lesion. So that can all cause changes in intracranial pressure. So the blood flow to the brain, they can use positron emission tomography, which is known as a PET scan, or angiography to check the blood flow in the brain, which is pretty neat that they can do it. So PET scan is a computer-generated image based on the metabolism of injected radioactively labeled substances. So they can trace those radioactive substances in the cerebral blood flow. Angiography is they inject a dye into the carotid or vertebral artery, and then they do a sequence of X-ray images to see how that dye flows. So you don't really need to know that for the exam, but it's nice to know when you see, they did a PET scan or they did an angiography, you might kind of get an idea of what they're looking for, and what they're looking for is they're looking for what is going on with the cerebral blood flow. So the venous system, of course, the arterial system brings the blood to the brain. We need the venous system to drain it back out. And the major venous system of the brain consists of cerebral veins. And the veins drain into dural sinuses and then into the internal jugular vein to return to the heart. So there are two sets of veins that drain the cerebrum, superficial and deep. That's really all you need to know. You don't need to know what specific areas they drain. But of course, we have a way to get blood to the brain, and we have a way to drain the blood out of the brain and get it back into the circulatory system.